I fell in love with cats when I had an old roommate of mine that had a big Maine Coon named Bunny.
He says no.
Where a dog wants to please you and do everything for you, cats have their own ways and agendas, and they're just such fun to watch. And they really do get attached to you and vice versa, obviously. Ralph, I got as a kitten in 2004. I got him when he was 8 weeks old. He was a smallish orange tabby, and he was always a bit odd. He was just hilarious, but he always had to be near you. He just was very much a people cat, and he would take to new people instantly. February 2017, I noticed his appetite wasn't as good as it usually was, and he was vomiting occasionally, more so than an average hairball. So I took him into the vet, and we did a blood test, and he showed the very beginnings of chronic kidney disease. So we immediately tried to put him on prescription food, and that was a struggle because he didn't want anything to do with the prescription food. Ralph was notoriously the most difficult cat I owned to give medicine to. You would have to kind of sit and then try to pop the pill in the back of his throat, and he would struggle the whole time. And then if you got the pill, he'd foam at the mouth and run around and try to spit it out.
I always say that the easiest pill you'll ever give a cat is the very first one. And after that, he says never, ever again. Mirataz is the first and the only FDA-approved transdermal medication for the management of weight loss in cats. We know that about 9 million cats come in every year to veterinarians for unintended weight loss, and yet only about 2 million of them go home with a medication to actually address that unintended weight loss. So we developed Mirataz, which is a transdermal ointment, so it's one less pill the owners have to give the cats, that is applied to the inner surface of the ear that has clinically proven to help the cats regain weight.
When I learned the Mirataz was transdermal and I could just rub it in his ear, I thought, that part I was ecstatic about, but I was curious if that was actually going to work. And when it did, it was amazing. It just was, especially as you saw his weight start to increase, he was basically back to his old self. So that was a really good feeling. And at least that component of it was under control. That was a huge relief, huge relief.
You know, it is so awesome to see when our drug can actually change the life of a patient, and the relationship between that owner and that cat is the most important thing. Well, you can imagine when you're the owner and you go to give your pet a pill that it doesn't like and it runs away, how that affects how you feel, how the pet feels about you, and ultimately can affect whether or not the pet gets that medication long term, because the owner doesn't want to do things that make them unhappy. And that's really where Mirataz came to be. We knew that there was mirtazapine that was effective, but not being delivered to cats and owners in a way that they could use it easily.
So I'm really grateful that my vet suggested the Mirataz, because I really do think without that, I would have lost him a lot sooner than I did. And he had a great quality of life. He was his old self. He was always active and running around, even with the younger cats, and sometimes putting them in their place. And he had a really good quality of life after that diagnosis, which I was very grateful I was able to give to him.
Mirataz, mirtazapine transdermal ointment, is indicated for the management of weight loss in cats. Mirataz, mirtazapine transdermal ointment, is for topical use in cats only, under veterinary supervision. Do not use in cats with a known hypersensitivity to mirtazapine or any of the excipients. Do not use in cats treated with monoamine oxidase inhibitors, MAOIs. Not for human use. Keep out of reach of children. Wear gloves when handling, applying, wash hands after, and avoid contact between the treated cat and people or other animals for 2 hours following application. Use with caution in cats with hepatic and kidney disease. Cats' food intake should be monitored upon discontinuation. Safety has not been evaluated in cats less than 2 kilograms, less than 6 months of age, or in breeding, pregnant, or lactating cats. The most common adverse reactions observed during clinical trials were application site reactions, behavioral abnormalities, vocalization and hyperactivity, and vomiting. For product label, including complete safety information, visit kindredbio.com/Mirataz-PI or contact Kindred Bio at 888-608-2542.